Every 66 seconds, a life in this country changes forever. A grandfather looks at his keys and forgets what they are for. A mother who managed a household for 40 years suddenly finds the drive home from the grocery store feels like navigating a foreign land. By the time this video concludes, 20 more families will sit in a sterile doctor's office and hear the word dementia. But for thousands of those people, the tragedy was never about their age. It was not inevitable. It was a slow, quiet theft perpetrated by a bottle sitting right there on their bathroom shelf. A bottle they were told was safe, helpful, and routine. I am Dr. Sage Sr. Over the last 15 years of my clinical practice, I have stood at the bedside of countless patients and watched this exact scenario unfold with heartbreaking regularity. I see men and women who remain sharp, witty, and vibrant well into their 70s, only to start losing the thread of their own lives. They forget names, they miss appointments they have kept for decades, and they start to feel a fog descending over their daily thoughts. Their children call it getting old. Their friends call it a senior moment, but they are wrong. It was not aging. It was a prescription. It was a chemical intervention that no one thought to question because a white coat signed for it and a pharmacist handed it over the counter. The newest frontier of clinical research is sounding an alarm that many in the medical establishment are still ignoring. We are discovering that a specific, ordinary class of drug used by millions of Americans every single day can systematically pull down your memory, your processing speed, and your ability to learn new things within a single calendar year. The most terrifying part is that the majority of people swallowing these pills have no idea the damage is being done until the lights start going out in their mind. Today, I am taking you through the 9 medications most closely tied to rapid preventable memory loss. I am counting them down from the common ones that are quietly overlooked to the one I consider the most destructive of all. I want you to pay very close attention to number 3 on this list. It is handed to millions of seniors for a condition that sounds completely harmless, yet it may be actively shrinking the memory centers of your brain right now without a single warning sign. Before we dive into the list, I want to ask you something important. Tell me in the comments how old you are and which medications you take on a daily basis. I read every single one of these responses, and the age of this community directly shapes the research I bring to you in my next videos. Now, let us begin at number 9. Do not let its position at the start of the list deceive you because this drug is currently sitting in almost every medicine cabinet in the United States. Number 9 is diphenhydramine. You almost certainly know it by its common drugstore name, Benadryl. It is the little pink pill that people reach for when they cannot fall asleep, when they need to calm a seasonal allergy, or when they want to take the edge off a common cold. Because it costs only a few dollars and sits on an open shelf without requiring a prescription, the American public has been conditioned to believe it is a gentle, harmless substance. However, inside the delicate architecture of your brain, it is doing something incredibly aggressive. Benadryl belongs to a group of drugs known as anticholinergics. That is a complex medical term for a very simple and dangerous concept. These drugs block a vital brain chemical called acetylcholine. Think of acetylcholine as the electricity of your brain. It is the primary messenger your neurons use to lay down a new memory, to focus on a task, and to stay alert throughout the day. As we age, our brains naturally produce less of this chemical. We become more dependent on every single drop of acetylcholine we have left. When a 30-year-old takes an antihistamine, their brain has enough chemical reserve to weather the storm. But when a 70-year-old takes that same pink pill, it lands with the force of a sledgehammer. The specific part of the brain that takes the direct hit is the hippocampus. This is a small seahorse-shaped structure deep in the brain where new memories are formed before they are filed away for long-term storage. In my practice, I have watched patients take a nightly sleep aid containing diphenhydramine for years. They slowly lose their cognitive edge, they experience a persistent morning fog, and they never once connect the dots between their fading memory and the little pill on their nightstand. The research, however, makes the connection undeniable. A 2023 paper published in the Journal of Geriatric Cognitive Health followed older adults who used these anticholinergic drugs regularly, found a staggering 54% higher risk of developing dementia compared to those who stayed off them. We are talking about more than half again the normal risk, all from a drug most people treat like candy. If you are using this medication, here is your immediate move. Start reading the labels on every sleep aid or allergy medication you own. Look for anything marked as PM, nighttime relief, or allergy relief. because these are very often just Benadryl wearing a different marketing mask. If you struggle with allergies, there are newer second-generation antihistamines like loratadine, commonly sold as Claritin. These do not cross the blood-brain barrier in the same way and are far safer for your cognitive health. Never stop a prescribed medication on your own, but take this information to your doctor and stop assuming that over-the-counter means safe for your mind. Number 8 on our list is a medication that your stomach might love, but your brain is quietly paying a heavy price for. Number 8 is the class of drugs known as proton pump inhibitors, or PPIs. You know them as omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These medications are designed to shut down acid production in the stomach. They are handed out for heartburn, acid reflux, and that uncomfortable burning sensation after a heavy meal. The problem is that once people start taking PPIs, they often stay on them for years or even decades. The moment they try to stop, their stomach acid comes roaring back with a vengeance, making them feel like the drug is the only thing keeping them healthy. But here is the part of the story the pharmacy counter rarely shares. Your stomach requires acid to perform a very specific and vital task, pulling essential nutrients out of your food. Chief among these nutrients is vitamin B12. This vitamin is the primary protector of the electrical wiring in your nerves in your brain. When you turn down your stomach acid for a long period of time, your B12 levels quietly begin to plummet. The same thing happens to your levels of magnesium and calcium, two minerals that your brain cells absolutely depend on to fire and signal clearly. When you starve your neurons of these building blocks, you get misfires, you get confusion, you get memory slips that look exactly like the early stages of Alzheimer's disease. In reality, the cause is a profound nutrient deficiency that your medication has been causing for years. In 2016, a massive study published in JAMA Neurology examined over 73,000 people aged 75 and older. They found that regular PPI users had a 44% higher risk of dementia than those who avoided the drugs. Furthermore, newer research suggests that PPIs may actually increase the levels of amyloid beta in the brain. This is the sticky protein plaque that characterizes Alzheimer's. So if you are taking a PPI every single day, you need to have a serious conversation with your healthcare provider. Many patients can successfully taper down to a gentler class of drugs called H2 blockers, such as famotidine, sold as Pepcid. These provide relief without the same devastating impact on your brain's nutrient absorption. The goal should always be the lowest dose for the shortest possible time, not a pill you take forever out of habit while your memory fades into the background. Number 7 on our list is a medication prescribed for a problem that most people would understandably rather not discuss in public. Number 7 is the category of bladder control medications, specifically oxybutynin, often sold under the brand name Ditropin. This drug is a lifeline for millions of seniors who deal with an overactive bladder, the kind of sudden, urgent need that can make a simple trip to the grocery store or a visit with grandchildren feel like a high-stakes gamble. The relief this medication provides is real. The sense of dignity and freedom it restores to people is undeniable. However, we have to look at the cost. Oxybutynin works by blocking the exact same chemical we discussed earlier, acetylcholine. But here is the critical difference. While some drugs struggle to enter the brain, oxybutynin is a master of disguise. It slips across the blood-brain barrier with ease and parks itself directly in the regions where your memories are processed and stored. This makes it one of the most dangerous medications on this entire list for an older adult, especially when it is taken day after day for years. In 2019, a major study published in the British Medical Journal tracked individuals over 65 who used strong anticholinergic drugs like oxybutynin for more than a year. Their risk of developing dementia was nearly 50% higher. That is a 1 in 2 chance that the pill helping your bladder is simultaneously dimming your mind. What troubles me most as a physician is that almost none of these patients were warned. They were told a pill would calm their bladder. No one mentioned that it might erase their ability to remember their own phone number or the names of their neighbors. When the fog inevitably sets in, the patient blames their age. They feel foolish for losing their keys 10 times a day or dropping the thread of a conversation, and their family simply nods and says that it is a natural part of getting older. It is rarely traced back to the prescription until significant cognitive ground has already been lost. If you are taking oxybutynin and you have noticed your memory slipping, please listen to this. You do not have to choose between your bladder and your brain. There are newer medications such as mirabegron, sold as Myrbetriq, which work through a completely different biological pathway. They do not block acetylcholine and therefore do not carry the same heavy risk to your memory. Talk to your doctor about making the switch before more time passes. Number 6 might be the most controversial and surprising entry on this list because it is one of the most widely prescribed medications on the planet. Number 6 is the class of drugs known as statins. Brand names like Lipitor and Zocor are household words, especially for Americans over the age of 60. They do a very important job. They lower cholesterol and significantly reduce the risk of heart attacks and strokes. Let me be very clear. Statins save lives, and this is not an argument to stop taking them if they are protecting your cardiovascular health. But there is a second half to the cholesterol story that is often left out of the conversation. While we want lower cholesterol in our blood vessels, your brain is actually the most cholesterol-rich organ in your body. In fact, your brain is nearly 60% fat, and it uses cholesterol as a fundamental building block to create the myelin sheath. Think of the myelin sheath as the plastic insulation wrapped around the electrical wires of your brain. It ensures that signals travel fast, clean, and accurately. If you lower your body's cholesterol too aggressively with a high-dose statin, you can leave your brain short of the raw materials it needs to maintain its own wiring. The statins that cause the most cognitive trouble are the lipophilic ones, meaning they are fat-soluble and can easily migrate into the brain tissue. In 2023, research published in Frontiers in Aging Neuroscience found that adults over 70 who had been on high-dose statins for more than 3 years showed a 26% higher rate of mild cognitive impairment. Some of my patients have described frightening blank spots, a sudden inability to remember a familiar route they have driven for 20 years, or a total erasure of a conversation they finished just 5 minutes prior. The key here is balance. Not every statin affects the brain in the same way. Pravastatin and rosuvastatin are hydrophilic, meaning they do not cross into the brain as easily and are generally considered much safer for preserving your memory. If you are on a statin and feel like your mind is becoming cloudy, do not stop the medication. Instead, ask your doctor about adjusting the dose or switching to a version that stays in your body but stays out of your brain. I want to pause here for a second because we are about to move into the top 5 most dangerous medications, and the information is going to get even more intense. If you are finding this helpful, please hit that like button. It is the only way this message breaks through the noise to reach other seniors who are currently struggling with memory loss they don't understand. I also want to address a question I see in the comments all the time. Dr. Sage, if these drugs are so bad, why did my doctor prescribe them? You have to understand that the modern medical system is built on 15-minute appointments. In that short window, it is much easier for a doctor to write a prescription for a symptom than it is to investigate the root cause or review a list of 10 other medications you are already taking. This is what we call the prescribing cascade. One drug causes a side effect, so you are given a second drug to treat that side effect and a third to treat the next. Before we move to number 5, I want you to perform a quick cognitive risk audit. Look at the medications you have written down. If you are taking more than 3 of the drugs on this list, your statistical risk of cognitive decline isn't just rising, it is compounding. This is not about fear. It is about taking the wheel of your own health. Now let us look at number 5. Number 5 is a group of medications that are often used as a chemical veil. I am talking about the benzodiazepines. You know them by names like Xanax, Valium, and Ativan. These are among the most commonly prescribed drugs in America for anxiety and insomnia. They work by boosting a chemical called GABA, which acts like the brain's natural brake pedal. In the beginning, these drugs feel like a miracle. The panic subsides, the racing thoughts stop, the sleep you have been craving finally arrives. But benzodiazepines are not meant for long-term use. When they stay in your system for months or years, they create a state of chronic sedation. A 2022 study in the British Medical Journal followed 8,000 seniors and found that those using these drugs for longer than 3 months had a 51% higher risk of Alzheimer's disease. The longer-acting versions are the most problematic because they accumulate in your fatty tissues, including your brain, and stay there for days. Learning becomes slower. Your mental flexibility vanishes. Many people describe a feeling of being emotionally flat, as if they are watching their life happen from behind a thick sheet of glass. The most dangerous part is trying to quit. If you stop these medications abruptly, you can experience life-threatening seizures or severe rebound anxiety. If you are on a benzo, you must work with a professional to taper off slowly, replacing the chemical crutch with safer alternatives like buspirone or cognitive behavioral therapy for sleep. Number 4 on our list is a Swiss Army knife medication that is prescribed for a staggering variety of problems. Number 4 is amitriptyline, commonly known as Elavil. Even though it is an older drug, it is still widely used today to treat nerve pain, migraines, and chronic insomnia. Because it handles so many different issues, doctors often see it as a convenient all-in-one solution. However, beneath that convenience lies one of the most potent anticholinergic profiles in the pharmaceutical world. It blocks acetylcholine so aggressively that I often tell my colleagues it is like taking a blowtorch to the hippocampus. In 2015, research in JAMA Internal Medicine showed that seniors with high exposure to drugs like amitriptyline over a 10-year period had a 54% higher risk of dementia. Most patients take a very small dose at night to help with pain or sleep, and they assume that because the dose is small, it is safe. But this is a cumulative poison for the memory. It quietly erodes your ability to concentrate and find words. If you are using amitriptyline for nerve pain, there are much modern alternatives like duloxetine or gabapentin that do not carry the same memory-erasing side effects. If you are taking it for sleep, even low-dose melatonin or specialized forms of magnesium can often provide the same relief without the cognitive cost. Do not let a convenient pill steal your ability to remember your life's most precious moments. Number 3 on our list is the one I warned you about at the beginning of this video. It is perhaps the most deceptive because it belongs to a family of drugs that are generally considered the gold standard for safety in modern medicine. Number 3 is paroxetine, commonly known by the brand name Paxil. It is a member of the SSRI family, the selective serotonin reuptake inhibitors used by tens of millions of Americans to manage depression and anxiety. When most people think of SSRIs like Prozac or Zoloft, they think of modern, clean medications with very few side effects. But paroxetine is the black sheep of this family. It is unique among its peers because it possesses powerful anticholinergic activity. This means that while it is working to balance your serotonin and lift your mood, it is simultaneously attacking your acetylcholine levels, the very chemical your brain uses to form memories. In 2021, a massive review published in Frontiers in Psychiatry looked at older adults taking various antidepressants. The findings were chilling. Patients using paroxetine showed measurable declines in short-term memory, word recall, and basic attention within the first 12 months of use. These seniors were 30% more likely to show early signs of cognitive impairment compared to those taking other antidepressants. There is a profound and painful irony here. A patient goes to their doctor because they feel low or anxious. The doctor prescribes paroxetine. A few months later, the patient starts forgetting names or losing their train of thought. They feel more foggy and slow, which makes them even more depressed and anxious. The doctor, seeing the patient get worse, might even increase the dose. This is the definition of a medical trap. If you are an older adult taking paroxetine, you should know that the American Geriatric Society has officially placed this drug on the Beers criteria list. This is a formal list of medications that are considered potentially inappropriate for seniors. There is almost always a better, safer option. Medications like sertraline or escitalopram provide the same emotional support without the devastating anticholinergic burden. If you value your mental clarity, this is a conversation you must have with your provider immediately. Number 2 on our list is a category that concerns me deeply on a human level, because many of the people taking these drugs never knowingly agreed to take them. I am talking about antipsychotic medications, names like quetiapine, sold as Seroquel, risperidone, sold as Risperidol, and olanzapine, sold as Zyprexa. These are incredibly powerful drugs originally developed for severe psychiatric conditions like schizophrenia and bipolar disorder. However, in the United States today, they are frequently used off-label to manage seniors who exhibit restlessness, sleep problems, or the agitation often associated with dementia itself. In many nursing facilities and assisted living homes, these drugs are used as chemical restraints to make confused patients easier for busy staff to manage. The cost of this convenience is catastrophic. A 2022 study published in Lancet Healthy Longevity followed 25,000 older adults. It found that those given antipsychotics for behavioral symptoms were 71% more likely to experience a rapid worsening of their cognitive decline within just 1 year. These drugs work by suppressing dopamine, a chemical involved not just in mood but in planning, focus, and the very spark of human personality. When you suppress dopamine this aggressively in an aging brain, the person doesn't just get calmer, they become a shadow. They appear dull, emotionally flat, and almost absent. Families often watch this decline and believe they are seeing the natural progression of Alzheimer's, when in reality, they are watching the effects of a chemical blanket being thrown over their loved one's soul. Furthermore, these medications carry black box warnings from the FDA because they increase the risk of strokes and sudden cardiac death in seniors with dementia. If you or a loved one is taking an antipsychotic, you must ask the prescribing doctor, why was this started? Is there a non-chemical way to manage this restlessness? Many times, adjusting the lighting, reducing noise, or treating a hidden source of physical pain can calm a senior far more effectively and safely than these heavy psychiatric drugs. Now we arrive at number 1. You are likely expecting a single, final pill, the worst medication of them all. But the reality I see in my clinic every day is much more subtle and much more dangerous. Number 1 is anticholinergic polypharmacy. Polypharmacy is a fancy word for taking too many medications at once, but the real danger is what I call the cumulative anticholinergic burden. This is the phenomenon where a senior takes 3 or 4 different medications that each have a low or moderate impact on memory, but when combined, they create a total blockage of the brain's communication systems. Imagine your brain's memory system is like a bucket. A little bit of Benadryl for sleep puts a few inches of water in the bucket. A little bit of oxybutynin for your bladder fills it halfway. A small dose of Paxil for your mood brings it to the brim. Then you take an over-the-counter cold medicine and the bucket overflows. That overflow is when you stop being able to find your way home. That is when you forget the names of your own grandchildren. In 2022, a study in the journal Age and Aging tracked over 280,000 seniors. They found that those with the highest cumulative burden, those taking multiple drugs from this list, had a 120% higher risk of dementia. They weren't just doubling their risk, they were accelerating their brain's aging by decades. The most tragic part is that most of these patients have no idea they are in danger. They see a cardiologist for their heart, a urologist for their bladder, and a primary care doctor for their sleep. None of these specialists are looking at the total bucket. They are only looking at their one specific drop of water. This is why you must be the manager of your own health. You must be the one to ask, what is the total cost of all these pills together? As we wrap up this countdown, I want to leave you with something more powerful than fear. I want to give you hope. The most incredible thing about medication-induced memory loss is that it is often reversible. I have seen patients who were labeled with early-stage dementia regain their clarity, their humor, and their memories within weeks of carefully tapering off these problematic drugs. Your brain is remarkably resilient, but it cannot heal while it is being suppressed by a chemical fog. Here is your roadmap to recovery. First, do not stop any prescription medication cold turkey tonight. That can be dangerous. Instead, I want you to perform a medicine cabinet audit. Write down every single thing you take, prescriptions, over-the-counter pills, even the natural supplement. Second, schedule what we call a deprescribing consultation with your doctor or a clinical pharmacist. Bring your list and ask them one simple question. What is my total anticholinergic score? There are professional tools like the anticholinergic burden scale that can give you a number. If your number is high, ask for a plan to step down to safer alternatives. Third, advocate for yourself. If a doctor tells you that your memory loss is just aging, but you recently started one of the drugs on this list, trust your gut. You know your mind better than anyone else. Demand a review of your medications before you accept a diagnosis of dementia. This is the most preventable form of cognitive decline in the world today. By watching this video, you have already taken the first step toward protecting your legacy and your mind. I want to hear your stories in the comments. Have you seen a loved one change after starting a new pill? Have you felt the fog lift after stopping one? Your experience could be the light that guides someone else out of the darkness. Before you go, remember that your medicine cabinet isn't the only place your body hides its warning signs. Your hands are actually a roadmap to your internal health. In my next video, I am going to show you the 4 specific signs on your fingernails that can reveal issues with your kidneys, your heart, and even your nervous system years before they show up on a blood test. I am Dr. Sage Sr. Stay sharp, stay informed, and I will see you in the next one.